grab some gloves, smaller or medium. Medium's fine. And then again, you just want to make sure everything's ready. So you have your suction setup. I'll explain it step by step. So you have your suction canister, you have your wall suction that's connected to that. So here, guys, is where you guys can just gather around. This is where you can see how strong it is. We're going to continuous. You see how I turn it on? Some nurses just automatically put it on the full back. If you put that in the nares, that's gonna hurt. So you wanna go, let's say this patient is 5 years old. So we're going to that medium range. You guys have your reference, right? What is a 5-year-old in the 100 to 120? So we're just gonna go at 100, let's see. All right, there you go. And so now we're gonna check our patient, right? We have our little, let's use our little reference. I'm gonna borrow one of you guys' procedure. So you have that little thing. Thank you so much. All right, let's go over it. Perform hand hygiene, confirm identity. So we're gonna look at the patient's ID band. Very good. You're explaining to the parent. Supine position. If it's a 5-year-old that's buck wild right now, you're gonna wrap them around with a bed sheet. Let's just pretend this is their bed sheet and we're wrapping them around. Okay.
Is that 5-year-old?
5-year-old,
Oh.
yeah. You wanna grab a buddy just to help hold? Which buddy you want? Just grab him.
I'll grab Titan.
There you go. So imagine this kid's going crazy, right? All right, there you go. We're gonna wrap them around. Initially clean the child's nose with cotton wool. So let's say this 5-year-old, oh, just blow your nose.
Just blow your nose.
There you go. Now choose the size of the catheter and adjust the pressure depending on the child's age. So if it's a 5-year-old, how big of a catheter are we choosing? You have an 8, a 10, and an 18.
8.
Let's see. There you go. 8 French. Ask them to blow their nose, connect the wall suction. I did that already for you. All right, so feel free, you could open that up. So the way that they made the packaging is for sterile processes. So here you don't have to do it sterile, but just be mindful of it all. So you want to take that to the side and you want to see where the actual catheter is. Here we're going to just show out our friends so everybody can see. All right, take that to the side. You're going to pull out that baggie. There you go, and that's the catheter itself. So that's why you see how it's all contained in there, just so we can keep it a sterile process, but you don't have to do it here, okay? And then there's also sterile gloves in here, again, for if it's your facility requires it to be a sterile process. All right, so what you're gonna do is connect it to the suction tubing. So you have your tubing right there. And what you wanna be mindful of, I know it's like kind of flailing around right now, but if it was a sterile procedure, you see your catheter, it's kind of like going on the bed. So you wanna, maybe you could wrap it around your hand so it's protected. There you go. You wanna keep it as clean as possible. You're gonna connect it to the suction tubing, very good. And you see that valve, that opening, that's how you turn it on and off or make the suction go. So when you put your thumb on it, that means you're suctioning. And then when it's off, it's not going. Even if it's connected to this. So you wanna just make sure that is on, and then you're turning on and off via the valve. All right? You wanna first test the patency with some sterile water. So you're gonna dip that end in there. Nicely done. And let's just pretend that we have some lube. So I'm just putting some lube there. You would put the tip into the lubricating jelly. Very good. All right. So now in terms of the procedure, we're gonna go little by little. Again, you have your assistant holding the patient down. Let's say I'm the parent, I'm helping you holding the head. And you're gonna pick one nostril. Are you good with your dexterity, like left or right hand?
Yeah.
You're okay. Okay. And so you're gonna slowly go against the pharyngeal wall. And then you see how much slack you have in the beginning over here? Hold it a little bit closer to the end of the tip because you want a little bit more handle on that. And then when you first insert it into the nares, then you could slowly push with your fingers.
Do I keep this open?
So good question. So you're gonna keep that open for now because you don't want to suction when you're first going in. So keep that open like you are and then slowly push the catheter in. Good job. Little by little. Really hold the catheter. That's yours. Because imagine the kid is probably doing a little bit of this right now, like,
No, he is guaranteed.
He's for sure.
He
And
is
trying to
doing
pull
that.
this at the same time.
Okay.
Feel it. And so what you want to do is either feel resistance, or if you feel there's a cough elicited. So let's say it goes, now you could put your thumb on there and then slowly backtrack, not more than 10 seconds. And some people do a little on and off, some people keep it on. Good. And then you probably should see some stuff in there. All right. Some people estimate like 2 to 5 like mLs that you get, but it depends on the patient. I would say maybe just go a little bit more in, because I think you just had a little bit in there. And you really could go down like a good amount to get some good. So you could go down one more time. Actually, try the other. So you would lubricate again, let's say, or let's say, flush it with the sterile water, put some lubricant again, and then go in one more time on the other nostril. Good job. You might feel resistance just because it's the mannequin.
Oh, okay.
Yeah, but like sometimes you have to like really open up the airway a little bit. I like to go against the pharyngeal wall, so like almost like a loop going backwards. You feel how it's much
Yeah,
better.
yeah.
There you go. And keep going in, like be right in front of the patient. Yeah, go keep this arm close to that. Yeah, get in their face, because you want enough slack to, if you have to go in there, there you go. And you'll feel like at this point, I'm pretty sure you'll get a cough, and then you could close the valve and then suction back. Going in the rotation motion. Good job.
Good.
There you go. Nicely done. How'd that feel?
Okay.
Okay? Right? It just needs practice.